All right, good evening, everyone. Thank you for joining us for this wonderful program that we have for you today. Before we get started, though, I wanted to take some time out and thank our sponsors because it is with their support that we can provide exceptional programs such as this to our members. I want to say a special thank you to Ice Miller for being a premier sponsor. I also want to thank HEPI for being a platinum sponsor. Thank you to our gold sponsors, End of Care, Arc Design, Cornerstone, and Cat Sapper and Miller. Thank you for all your support. All right, now let's dive into our program. And as I'm reading this, please feel free to answer the poll that you see up in front of you. Thank you for joining us. We have an amazing program for you that is the first part of a 3-part career development series. With today's program being titled Pivoting During the Pandemic. Rachel Vergara, our speaker, is a nationally recognized as a cross-sector human resources, career management, and diversity and equity inclusion expert with clients in healthcare, nonprofit, and higher education. During her tenure with ACHE, Rachel served as a key player in advancing digital career management resources for executive leaders of ACHE and improved the effectiveness of the Leadership Mentoring Network. Today, Rachel is a principal consultant, executive coach, and dynamic speaker who uses her unique blend of intercultural competency and career management expertise to serve as a catalyst for workplace excellence and to promote belonging. She has presented to thousands of professionals, from undergrad students to the senior executives across the nation, as a thought leader. In 2017, the American Society of Association Executives and Association Forum awarded Rachel their 40 Under 40 Award. In 2018, she was selected as the American College of Healthcare Executives Employee of the Year Award. With that, Rachel, I will turn it over to you.
All right. Well, Rodney, thank you for such a warm welcome this afternoon. And, I would be remiss if I didn't start by just letting you, Joseph, Corey, and everyone else who was involved in creating this space for us to have this conversation today. Just a thank you. And also I want everyone participating to know that I have an unwavering respect and admiration for you, because whether or not you have personally been on the front lines during the past couple of years or are leading those who are, no one has been impacted by the pandemic more than you. And so let's start off by calling out the elephant in the room and being completely clear. There is no one who knows how to perfectly pivot during the pandemic. And if someone is leading you to believe that they are, they're not only trying to fool you, but they're fooling themselves. Because, if we just really sit here and think about it, in the past 2 years, not only have we been battling the public health ramifications of COVID-19, but those issues have been exacerbated by the civil unrest triggered by George Floyd's murder. And now we're experiencing the economic impacts of the war between Ukraine and Russia and all the personal effects that have happened in between. I need to take a breath just thinking about all of that. And so I think our first and most important pivot of all during today's conversation is stepping outside of the stagnant safety of this information age that says we should know everything and cancel everybody along the way who makes a mistake, and instead remember that every era of progression in our nation's history was the result of seasons of discomfort and unpredictability, like we are experiencing right now. And so you might be saying to yourself, well, Rachel, if no one knows how to pivot during a pandemic, why am I here this afternoon? Well, I'm glad you asked that question. While we may not know how to perfectly pivot during a pandemic, we can certainly make informed decisions based on our understanding of how we've been impacted individually, how others around us are impacted, and most importantly, in terms of today's conversation, how the healthcare profession has been and continues to be impacted. So you can probably already tell by how I'm starting that this is not the kind of conversation that you can kind of tune in and tune out of while you're doing work in the background. Maybe that'll be the case for you, but I want to take this moment and just invite everyone who, if your background noise is clear and you're in a safe space to do that, i.e. not driving, I want to invite you to turn your cameras on. You can even open up your mics to laugh at my sarcastic and corny jokes throughout, because I want to remind you that one of the biggest benefits of being a member of IHIN is the collective intelligence of spaces like this. There's really nowhere else you can go where you have individuals across sectors in healthcare across the board like this, and participating in conversation. So I will be inviting you, whether you have your cameras on or not, if you just are willing to open up your mics, I will at numerous junctures be inviting you to engage with us. So thank you, Carla and Sheila and Rodney, for being brave enough to turn your cameras on, and I invite others to do that throughout as well. And so the first thing I want to also encourage you to do is, while I have a full agenda of plans, of discussions that we can have, the most important thing for me is that you walk away having your questions answered, that you walk away hearing the opinion of me and others on the topics that are your biggest concern. And so I'll be silent for 1 or 2 minutes here, and I want to encourage you to take out a pen and paper and just write down what some of those thoughts are that you're coming into today's discussion with. And I say pen and paper, but it also may be opening your digital notepad, and that's okay too. You can even write it in the chat if you want to share, but I don't want my direction to make you lose sight of what's important to you. And as you may have already heard, I have a 2-month-old and a 2-year-old who don't always respect my privacy in meetings. So full disclosure that they may make cameos here throughout, but I'll work with my husband to try to keep that in control. All right. And as some of you are still collecting your thoughts, I'm going to take this opportunity. I know a couple of you came in late. Actually, you might not have been able to participate in the poll, but I did want to take this time and share with you the results as my first step in sharing with you kind of the collective of what's going on. And so if you're looking at the results, the first question I asked was, what has been your biggest professional challenge during the pandemic? And I think, then I'm stopping myself from getting ahead of myself with content here. But as you see, it's pretty even split. I think we're seeing burnout maybe being the leading cause, but time management, turnover, maintaining connections, we are all being impacted in different ways. Full disclosure, for anyone who said job searching and career advancing as being your top priority, this conversation will be helpful for you, but you'll definitely want to mark your calendar now for part 2 of this conversation. We'll specifically be talking about how to advance when you have limited experience, and that'll be on April 12th at the same time. So we'll talk a little bit about that, but I think you'll especially want to join us for part 2 of this conversation. All right. If you can write a big yes in the chat for me, if you are currently using ACHE's Career Edge. If you're using ACHE's Career Edge tool, write a big yes. All right. Jeanette's using it. Let's see, anyone else? Let's see, out of all participants, it looks like the overwhelming majority said not. A couple of you are unfamiliar. So if you're unfamiliar with what Career Edge is, it is ACHE's strategic career planning tool, and it's completely complimentary to you as a member benefit. So if you are using it, you are in the right place, because we're going to talk ways about how you can be maximizing your use of it today and beyond. And even if you're one of the people who checked, no, I'm not only not using it, I don't even know what it is, you're also in the right place, because after the end of today's conversation, you will know how to use it and exactly what it is. The reason I'm starting by asking that question is because today's conversation is heavily centered around part 2 of the Career Edge tool. So Career Edge consists of three primary steps. Sorry, I was struggling to multitask because I wanted to share my screen with you at this juncture. So there are three primary steps in the use of the Career Edge tool. Step one is establishing your goals. Step two is the discovery process. And then step three is where you develop your plan. Today's conversation, we're going to center and focus around the discovery step, which is part two of Career Edge, where you will be led through doing two key activities: a self-assessment of yourself, of your values, of the competitive edge that you bring into your position and into the market. And then part two of that conversation is an overview of current trends and future projections in terms of what's going on in healthcare. And the most powerful piece of the Career Edge platform is what it's helping you to do is identify gaps, right? Wherever what you need is not being aligned, is not currently aligned with your current position or the industry, or if what you're focusing on in terms of your branding as a professional is not quite in line with what the market is calling for at this present time. And so within the next hour or so, we have a tall order. These are the 5 things that my overzealous agenda of what I'm hoping to accomplish with you is that we start off foundationally helping you to understand your values and competitive edge. We'll do an overview and talk a lot about what's been going on in the healthcare marketplace as a result of the pandemic and other events. And then we'll talk about what some of those in-demand qualifications for leadership are. And then we'll do some high-level conversation about what that means for you in terms of advancing your career and job search strategy. And all it's listed as step 5, but honestly, all throughout today's conversation, I'll be pointing out a number of ACHE tools and resources that you have available to you at your fingertips that you can use. One thing that I know I still connect with my colleagues and friends at the national level, ACHE, all the time. And I know one thing that we all always say is that if we had $1 for every time we introduced career resources and people said, oh, I didn't know that that was something I have access to as a member, you know, we could all retire. And so we want ACHE's national resources to stop being the best kept secret for you, and it's something that you're actively taking advantage of. All right. So I want to start by asking you, how did you end up in the healthcare profession? Working with healthcare leaders for the past 10 years has shown me that healthcare is not typically a profession that people choose to be in. Really, it chooses you. And even though I know this, whenever I ask a fellow healthcare administrator this question, to some degree, they always say to help people. So if that's the thought that came to your mind, I'm going to challenge you just to go a little bit deeper, because when we stop at the idea of just helping people, you know, it lets me know that the demands of your position has probably prevented you from putting a lot of thought into this question for a while. Because if we're honest with ourselves, whether you work at McDonald's or if you're an IT professional, a lawyer, or if you're in healthcare, to some capacity, we are all helping people. And I've also worked with healthcare professionals long enough to know that there are some of you who are internally kind of rolling your eyes at this point and are saying, blah, blah, let's just get to the results part of the conversation related to the pandemic. But I am taking a healthy chunk of the start of this conversation to focus on your why, because, you know, our culture that tells us, you know, work is something separate. We disconnect ourselves and our feelings from this workspace. It's the same reason why too many executives that I work with will work very hard, 18 months to 2 years to land the position, the salary, and the title that they want, only 3 to 6 months later to be reaching back out to me again to say, this isn't what I thought. It's not fulfilling me. It's not my why. I want to start the search process all over again and do something else. And so, you know, anyone who has ever read Stephen Covey's 7 Habits of Highly Effective People, maybe say a yes if you're on the chat, or if you're on video, nod your head if you're familiar with that book. You know, any of you who are familiar with that material, you know that everyone has a center whatever that may be, your family. For some of us, it is it's money. It's something that's driving all of the decisions that we make, and so it's dangerous for us not to be aware of what that is. And so research shows us that for most of us, it's not even the money, even when we think about it. And we don't even have to look at the research to know that. If we look at the most recent data that was released by McKinsey and Company, recent data shows that 80% of hospitals have vacant nursing positions right now, 60% of their broader clinical staff. And that's because the pressure that the pandemic brought on is showing individuals that that pressure outweighed whatever their why is. And so one of the first things that we're going to do is identify and look a little more deeply in terms of what your individual why is. And so I want to challenge you to think about that. And I'm going to show you a 2 to 3 minute quick video clip to get you thinking in this direction before we do a quick breakout activity and have you talk with your fellow members about this.
How do I know? A lot of people, when they think of the phrase, how do I know, they always want to put the what behind it. How do I know what I'm supposed to do? The question that you really should ask is, how do I know why I'm here? Because when you know your why, your what becomes more clear and more impactful. If you know, like for instance, people know that I do comedy, but that's what I do. My why is to inspire people to walk in purpose. So I can do comedy, I can write books, I can be in a movie, because all of it is motivated by my why. In fact, I have a new web series out called Michael Jr. Break Time. We probably just did the 6th episode. It's on YouTube. So every single Wednesday at 3 o'clock, we drop a new episode on YouTube of Michael Jr. Break Time. What it is it's me. I travel around the country and I do stand-up comedy, in case you didn't know. And in the middle of my comedy set sometime, I'll stop and just talk to my audience. And we've been filming this, and it's pretty cool. So we're in Winston-Salem. I'm gonna show you a clip from Winston-Salem. And I'm just talking to this guy in the audience, and he tells me that he's a musical instructor at a school. So I was like, all right, you're a musical instructor, can you sing? Let me hear you sing a song. So this is what happened at the last episode of Michael Jr.'s Break Time. Check it. So you're a musical director? Cool.
Yes, sir.
All right, so let me get a couple bars of like Amazing Grace. Can you do the first part of that? Go ahead.
Amazing grace, how sweet the sound that saved a wretch like me.
Wow. That bro could sing, you know what I'm saying? All right. Now, what you give me the version is if your uncle just got out of jail, you got shot in the back when you was a kid. I'm just saying, let me see the hood version real quick, if you know which version I'm talking about. Just see if that exists. Let me see what you got.
Amazing grace, how sweet the sound that saved a wretch like me. Right now I'm found, was blind, but now I see.
okay? Here's what I want you to catch. The first time I asked him to sing, he knew what he was doing. The second time, he knew why he was doing it. When you know your why, your what becomes more impactful because you're walking towards or in your purpose.
All right. So just a fun thought generator in terms of your thinking about your why in this in the healthcare space. Even though he was in music and not healthcare, I think that it definitely resonates in the same way for you. So the next thing that you are going to see pop up on the screen is a list of a number of different, in case you're having a hard time jogging thoughts in terms of where your values are and what's most important to you, or at a time what was most important to you in entering the space. So I'm sharing with you a number. There are 30 different values and priorities that are listed on this list. And so I'm also going to add it in the chat for those of you, if it's easier for you to just pull up the document yourself, if you're having a hard time seeing here. But what you're going to do is number the sheet of paper that you have from 1 to about, there are 28 total values, and you're just going to put an X in next to, you're going to put an X next to everything that resonates with you in terms of a value. And I'm just adding it in the chat for anybody who's having a hard time seeing on the screen here. So I'll give you 5 minutes, and then I'll scroll up to the next 10 or so. And then what we're going to do is there'll be a second part to this once you get through each one. And I'll look, pulling up the video panel so that I can see, or you can write in the chat when you're ready for me to move up to the next set. Or for those of you who downloaded it yourself, you can go through the whole list. And again, you're just marking an X for all of the core values that resonate, these are what's most important to you. What really matters. I'm scrolling down a little bit. Don't open your mic and yell at me or put it in the chat if I'm moving too fast past some of the ones you're looking at. Again, you're just putting an X next to the items that most resonate. We're talking about your values, what makes you feel fulfilled, what matters most to you. All right, so it looks like, at least from those of you who have your cameras on, it looks like some of you may have stopped writing a bit. And so what I'm going to do now is I'm going to go back to the top and annoy you a little bit. Now, if you put an X next to more than 5 of these, I want you to narrow down your list a little bit. So you're going to write down, if you had more than 5. If you've had more than 5, narrow your list and actually write down that value. So write down the top 5 for you. And again, I'll scroll up and down again. And I've also added the document in the chat. So you're narrowing it down to your top 5. This is what really matters to you. All right. And in the spirit of making sure that you connect with at least one other member today on this conversation, what we're going to do is I'm going to break you into just small groups, and we're only going to take about 5 minutes on this. You don't have to share with your partner or partners what the values are that you selected. But what I do want you to talk about is how difficult, and you can put it on a scale from 1 to 5, how difficult was it or easy for you to narrow it down to those 5 values? Okay, so you're, as a group, you're just introducing yourselves if you don't already know each other, but you're also talking about how easy or difficult of a time that you had narrowing down the list to the top 25. And Joe, I'm seeing your message of you're not seeing you're not seeing the document. Did you see it on the shared screen?
Yep, it's all on the shared screen. I just was referencing it. I haven't picked it up in the chat yet though, so.
Okay, did it pop up for you?
I was able to see it in the chat, but I had to download it to my desktop to be able to open it.
Okay, and now if you're on your, I know one thing is that if you're on your phone, it won't pop up for you in terms of attachments. So that could be the issue if that's for anyone else. All right, so I'm gonna go ahead. You'll have all of 5 minutes and it'll fly by. So you're just doing really quick introductions and you're sharing how easy or how difficult it was for you to narrow down to your top 5 values. And let's see, we'll make the group small because we don't have much time. So you'll either have only one partner or you'll have 2 partners. All right. And if you, for those of you on video, if you can give me a nod of the head, if everyone's clear on what you're discussing with your group members. Okay. All right. You should see your breakout rooms opening up right now. Oh, and Rodney, since you are a host, you can join. I don't know if it's going to put you in a room, but you can automatically just join one of the groups that only have 2 people.
Gotcha.
Or if you see that maybe if someone is in a room where the other person didn't join, like I see Carla, her partner didn't join.
Which room number is that? 5?
4. Oh, well, 4. Sean's didn't join, Carla is in 5. So you can go in 4, 5, or 7. I'm going to move. I'm actually going to move Sheila. Which one are you going to?
I'll go to 5, and can you move Sean to 5 as well?
Yeah, I'm moving people to balance the groups out. Okay, you went to 5, and let's move Sean. I'll move him to 7.
Okay.
Okay. There we go. Looks like everybody. Okay, you're going to 5 with Carla. Oh, no. Donzie came. So let me add. I paused the recording while you guys were in breakout, so I'll start that back as well. All right, everyone is back. In one to 2 quick minutes, anything burning come up in your conversations that anyone would like to share? Anything come up in your conversation in terms of how hard it was for you to narrow down your list? Maybe you talked about how long it's been since you thought about what made you go down the career path you're in.
So this is Sheila, and a common theme that we had in our group was that the 5 that we selected at this time probably wouldn't have been the same 5 that we might have selected 5, 10, 15, 20 years ago, depending on where we are in our career. And so what we see as important might depend on exactly what point in our career we're in. And those things, maybe our why changes.
Sheila, thank you for opening up your mic to share that. What a profound perspective to offer to this discussion, and important for you as leaders, as administrators, because part of your job is recognizing the different perspectives and experiences of your team. And so I think that not only is it interesting to hear the direction that your conversation went, I think, Sheila, you inadvertently dropped a nugget in the group for us to think about. And so if it's been a while since you revisit those foundational values that you have, I think now is a time more than ever that it's important to get back to that. And while values are tremendously important, it's not the only part of your self-assessment, and it's not enough just to know what matters to you and to help you to feel fulfilled. It's equally important to assess your own competitive edge and know what it is that you're bringing to the table to your employer and to your partnerships. While we don't have as much time to spend on this specific conversation in terms of breakouts, and I know it takes a little more time and reflection to go deeper in the conversation around your competencies, but don't feel rushed or compelled to hurry and write all of this in your notes or even take screenshots, because we'll share these slides with you following the event. But the slide you're looking at is a list of core competencies, and it's separated based on the 6 primary areas that within the healthcare profession. And so I think what's important as you're looking at this list is there is certainly no one individual, or it's not likely that any one individual within the group has all of these, core competencies. And in fact, if you feel like you have them all, I would challenge you to think about how you're thinking about what a core competency is. Your core competency are your strengths. You're not just something you have high level experience with, but it's really it's your niche. It's where you have, expertise. And so this is a comprehensive list of the most important competencies to have within the healthcare arena. And I'm bringing this up right now during our conversation around establishing your competitive edge, because I'm going to give you a little homework to do following this session today. I think we're having good conversation, but the real work happens when you log out of this Zoom, and it's what you do with this information. And so what I want to challenge you to do is the same thing. Go through this entire list, put an X or highlight the competencies that you believe that you have, but then I want you to go back and use a different color or circle what you feel is part of your competitive edge. It's what you are known for. It's what people associate you with. It's what you, or either it's what you want to transition into. It's how you want to be known, because that is a challenge of people. For those of you who are middle ground, you're not quite entry level, but you haven't broke the ceiling to be executive level. Sometimes it's not necessarily a good thing to be a jack of all trades. And that is a common challenge of being known for the area that you want to go into. And so pick what those 5 competencies are, and then think of stories and examples of how you've demonstrated those skills or how you brought value to those areas. And I want to be clear that while there's probably no one individual who has all of these competencies, it is likely that your skill sets will dabble into a number of these categories. So if you're a person who is, striving to be a COO, it is likely, and if you want to be successful in that transition, it's probably required that you have skill sets not only in strategy, development and leadership, but also in operations and finance. Whereas if you're someone who is interested in more of a director of marketing for a healthcare supplier, then perhaps you would only have core competencies that center more around marketing and leadership. And so I know that we have people in various places in their career participating. And so it's important to take this information and think of it in terms of how it relates to you as an individual. This is also a great tool for you to use if it's been a while since you've updated your resume. But again, I won't go too far on a tangent with that, because like I said, we're going to really talk deeply about the job search and career advancement piece of this conversation during our next meeting on April 12th. Also, if you have very specific questions related to establishing your own competitive edge, I will be doing a 1-hour kind of walk-in executive coaching session that we'll talk more details about, but next week at the same time. So if you have very specific questions to you, don't worry if we don't get a chance to talk about your specific situation today. All right. So, and this is the perfect, I think, segue into part 2 of our conversation. So we've done, so far, all we've been talking about is your self-assessment, what's important to you, where your competitive edge is. But the thing that amazes me the most is how many people just rely exclusively on their own opinions and experiences, and perhaps the experiences of their peers or people in their network, but they rely on their own perspectives to guide them without making an intentional habit to read, learn, and explore, what's happening right now in the healthcare profession and around the world. And so I think when it comes to your competitive edge, the biggest mistake that you can make is to be very clear on your own competitive edge and your own experiences without being able to make a very explicit connection between what you view to be your competitive edge and the needs of the market. And so, an example of that might be that you are a leader who has tons of experience in managing others under an organization that operates under a matrix structure, but you don't mention that at all on your resume because you don't think it's the most important piece of your experience. But little do you know that is one of the key terms that your recruiter or prospective employer, that their ATS or the artificial intelligence algorithms, that's what they're looking for in a job search. And so that's just one of many examples that I see all the time of people failing to align their resume, their elevator pitch, their networking conversations around the core competencies that matter to the person they're talking to or the organization that they're targeting. Instead, they choose to focus on the parts of their experience that they care the most about. And so again, just so that you know that you have as a resource, another slide that will be with your handout is not only the core competencies based on varying areas, but the leadership qualifications that are required for the leadership qualifications that are unique to what's going on in the world right now. And so I'm actually we'll come back to this conversation because I want to make sure that we get a healthy amount of time just to talk about what's going on right now in the healthcare marketplace and comparing that to where priorities and focuses were prior to the pandemic. And I'm just adjusting my screen so I can still see you in the chat as I share. Okay. So even prior to the pandemic, right, the healthcare arena, as you know, was changing at a faster pace than any other time in history already. So the healthcare marketplace makes up to about a sixth of the overall economy. And before the pandemic, I would consider the industry to be conventional in the sense that, lots of long-standing relationships, very traditional way of operating. Sometimes viewed as bureaucratic, but things just move at a very predictable kind of pace. We were starting to see a surge of acquisitions. I talked earlier a little bit about the matrix structure of organizations to improve communication and make changes in the start of new projects easier. We were starting to see in terms of, for my job seekers, starting to see these ATS and artificial intelligence systems take control of the initial screening of the interview process. So making it integral for you to have those keywords on your resume when pursuing opportunities, and even making cultural and psychological pre-screening assessments as a part of this evaluation process for new positions to make sure that you are the right fit for the positions that you are going after. I would say many of the effects of the pandemic, I wouldn't say completely changed the way that things are happening in healthcare, but certainly exacerbated the pace that things were moving in. So according to the National Healthcare Expenditure, overall healthcare spending increased by 9.7% since 2020, and government spending grew by 36%. That we're still seeing change happen at a rapid pace, but it's the change is even more hyper, more dynamic, and evolving more quickly than before. We're seeing changes in delivery channels in terms of telehealth expectations and even requirements based on changes, merges, and eliminations of roles, integrated medicine providers, changes and adjustments in terms of payment structures going beyond just insurance and paying out of pocket. And so we're seeing a number of changes that just were a direct result of everything being virtual for the past 2 years. And so in terms of, I started off this conversation today talking about the fact that, there is no one who knows specifically what will happen or what this means for the future of healthcare, but there is an anticipated growth of something, over 100,000 new jobs in healthcare administration that are projected to emerge over the course of the next 10 years. And I have listed here some of the areas that we're expecting those positions to emerge in. And so health and wellness, access to healthcare, more investment in public health initiatives in terms of, schools and making things available within in terms of as it relates to school settings, expansion of technology, emergency response and preparedness. And never fail when I share this information. I know the number one question I get is, well, where will those 100,000 positions be in? What will those titles be? And I think a good way to be predictive in that is by asking the question of what are the biggest issues and challenges that our CEOs are facing today in the healthcare profession. And I've been talking a lot. And so before I jump to the next slide and show you what ACHE's CEO survey results show as the top CEO issues, I'm interested in hearing from you. What would you predict to be on this list? And you can put it in the chat, even if your video isn't on, but I'm inviting you, if you feel comfortable, you can open up your mic, you can type it in the chat. What do you think will appear on the most recent top issues facing CEOs in healthcare? All right, not everyone, don't everyone open up their mic at once. Staff and the Great Resignation. You're spot on, Nicole, absolutely. Any other thoughts? Or what are you seeing, in your roles? Retention of clinical roles, absolutely. So Joseph is in the same thinking process. Employee engagement, absolutely. What we're seeing is what we're seeing on the list, and I'll populate everything here. So this is the 2020 ACHE's full listing of everything impacting, and it looks like I use Zoom to draw on the screen or something or the other. I will clear that off. But in the meantime, no, I went back. Okay, so this is the full list of ACHE's 2020 CEO survey. This is one resource if you're not familiar with. A new list is put out every year with this full, with all of the issues facing CEOs. And if anyone knows how I can clear this off, Rodney, I don't know if did I do this, or let me see. Let's see. Okay, got it. Sorry, it was distracting me, and I didn't want it distracting you as we talked about it. But this is the full list of issues in itself, many of which we call it. So financial challenges, personnel shortages, which was the key thing that came to your mind, behavioral health and addiction issues, government mandates, patient safety. But I'm actually going to jump to the next screen, because even going beyond ACHE's list, I want to point out the areas that I think are most affected by, that are the biggest impact, are most impacted by the pandemic. And so I'm highlighting the areas of changes in pay structure, shortage of healthcare professionals, addressing the rising costs of healthcare, recruiting top nursing talent, specifically managing Medicare and Medicaid, expanding the use of telehealth and virtual healthcare. That is one specific position that I'm seeing an emergence of, is the creation of director of telehealth positions, expanding on the use of telehealth and virtual healthcare, as I was starting to say, and then protecting against cyber attacks, which I think that the last item is across the board in terms of major institutions, not just in healthcare. I think something else that isn't listed here is equity in telehealth opportunities. I think access is a common conversation in terms of conversations around access, but telehealth opportunities are also another part of this conversation. Being abreast of the demographic breakdown of your institutions is integral for leaders. It is an observation that many times the individuals who are having the opportunity to work from home are higher positions, which sometimes are minimizing the number of Black and Brown and low income individuals who have the opportunity to work from home, even when their position could, where they could complete their responsibilities, which is a conversation around equity, because it is increasing, their exposure in cases like national pandemics. Also, another item that is coming up in a lot of conversations in terms of leadership are ergonomic considerations. Now that people have been working from home for 2 years and not having that kind of in-house staff to observe the way that we're sitting at our desks properly. I know that it's a big part of our daily conversations of neck and back pain and wrist pain and all of those considerations that in the long run will increase the use of Medicare benefits. So these are other, leadership important considerations for leadership. I know that there might even be some students or early careerists who are participating. And so I want to be sure to include or be sure that you know that there is data for you if you are trying to figure out where you might be able to get an entry into healthcare administration. This chart is a CAMI report that goes out every single year by that indicates where students are being hired within areas of healthcare administration. Right. And I think that that's a good stopping point to pause for a moment, because I've shared a lot of information with you in terms of what's happening. And so I'm interested, in hearing from you. What are things that that you were expecting to see on the list that weren't included? What are some of your reactions? Is this resonating to what you feel like you've been experiencing in your places of work? Such a chatty group you guys have.
I'll just mention, telehealth was on my list too. I almost wrote that first, and then I do feel like staff and retention is huge. I just heard an economist from Indiana University speak, and he said the number one thing you can do, and this applies to all organizations, the number one thing you can do right now is treat your staff well. Like, there is only a certain amount of talent pool out there that we're all competing for. And you have to completely rethink how employees are, how their benefits work, how they're treated, how they're listened to and engaged. And that is like going to really help you to, differentiate yourself and become a stronger organization for many years to come.
Carla, it's a great point. And, for you and for everyone's reference, one of the slides that will be included in the deck that I kind of went through to preserve time is some of the most sought after leadership qualifications at this time. And I think you hit the nail on the head with the top one on the list, which is change management. One thing that I would imagine, and I'm seeing some head nods that you're experiencing, is just that natural resistance to change. Even when it's necessary, it's just, uncomfortable. I would add innovative thinking to that list. We're experiencing so many challenges that we have never had to address in the past. And so, having that ability to think creatively and think out of the box in terms in terms of those solutions are integral. It already came up at a number of different junctures during our conversation today, but that emotional intelligence piece is recognizing that even though this is the way that I have been impacted by the pandemic, it may not be the same for those who are reporting to me. Looking back at that list of just burning thoughts and questions that you started our conversation with, we probably have time for at least one or two questions or comments, if they haven't already come up organically during today's conversation. I did want to just open up the floor for questions you have for me, questions you have of your peers while we're in this space. All right, I think Rodney and Joseph, that should mean on the evaluation when we ask that question of, did you get your questions answered? I think we're it's sounding like a yes at the present time. now they are referenced, and please at any point, I will, for anyone who has to do a hard stop at the hour point, I do want to just make sure everyone knows what will be included as a resource in the slides that we'll provide after today, but I will hang around for additional questions that might come to mind before we wrap up. But I do want to just share with you some next steps to consider, as well as the resources that I've included in the slides, because sometimes with presentations like this, I know I can walk away feeling like, okay, that was great information, but what does that mean for me in terms of what I should be doing moving forward? And so I started the conversation around competitive edge, around the marketplace, saying it surprises me, how infrequently I'm connecting with individuals who are making an intentional effort to remain abreast of what's going on outside of their own workspaces. And so here are a couple quick and easy steps that you can follow to make sure that you're remaining up to date in terms of what's going on in the market. It's reading, and in the slides, I have provided some top influencers in the healthcare arena outside of ACHE that I think can help add value to the healthcare conversations that you're having. And so there's an entire slide committed to that, as well as other associations that I recommend you follow. Volunteering is a great way to keep your and I'm stumbling because I'm trying not to go too deep into it, adding another, going too deep into the conversation. But at high level, I will just say volunteering is a great way to make connections for those of you who are interested in seeking a new position and or looking for career advancement. The time is now, even for those of you who are not interested in or not in the midst of a job search. You don't want to be the person in your network who people only hear from when they want something. So volunteering, and as I think is a very often overlooked way to build connection. And leaders here at IHN can tell you that I bet that there's no shortage of things that need to be done, even within your very own chapter. So volunteering is a great way. Of course, taking advantage of the professional development opportunities like this to just always invest in your own development, and then actively engaging to apply the knowledge that you're learning. I always pose the question to recruiters and leaders of, how much they value community involvement and volunteer experiences on resumes. And the answer to that question is always the same, is yes, it brings value, but even more so when the person had a title that was beyond a leader, beyond just a member. How did they use that experience to demonstrate leadership capacity? And so included in the slide deck towards the end, we won't go through each individual one, but I have provided for you some reflection questions to really help you to continue to think about not only your values, but your competitive edge, and just how you can be strategic about remaining abreast of changes that are happening in the healthcare market. So these are just some questions to help generate your thought process in terms of what's next. Here's a full list of what to expect over the remainder of the quarter in terms of the time that I'll be spending with your chapter, including a session next week at the same time where we won't have a formal agenda, but you can come with any questions that you have for me, and I'll be happy to talk with you and the other group members who attend about ways we can support you. We will have on April 12th, we'll be talking specifically about job search and career advancement. And then in May, we'll be talking about the taboo conversation about talking politics online. So if you enjoyed today's conversation, there's a lot more in store for the rest of the quarter. Here is a list of the ACHE references that I made throughout today's conversation, and a list of other influencers that I mentioned that will help you to remain abreast of what's going on in the market, as well as a number of other healthcare related associations that will help you in that area as well. And so before I turn the floor back over to Rodney and Joe to close things out, I just want to conclude by reminding you all about the legacy of Dr. Ignaz Semmelweis. If that name doesn't mean anything to you, it could very well be the reason that you are alive and well today, or his research, should I say, could be the very reason that you are alive today. He is known as the father of hygiene. And as hard as it is for us to fathom in 2022, the thought of people like not washing their hands and using hand sanitizer everywhere they go, back in the 1850s, people didn't regularly wash their hands when they went to the bathroom and when they ate, and even when they were doing surgery or, delivering babies. And so there was a high volume of death that came from bacterial infections. In fact, deaths were at the high point at that time than any other time in history. And so Dr. Semmelweis found a positive correlation between physicians washing their hands before these procedures and the reduction of moms and babies passing away and patients catching infections. And so once he discovered this connection, he knew his why. He had something that was driving him in his career. And so he tried to share this information with physicians. But all historical records about him say the same thing, is that he wasn't the strongest communicator, or in other words, he was rude in his delivery of this information. And so the doctors who he was trying to partner with, they probably weren't as in tune with their why. And so because they didn't like him and his communication style, they threw the baby, which was his research, out with the bathwater. Him. Does that sound like anybody's workspace that they're in right now? And so because of their arrogance and not wanting to believe that there was anything that they could change about themselves to make a positive change, in their unwillingness to pivot, this epidemic, it cost not only some people their lives, but it cost themselves and their institutions productivity. And so while the history books, they focus on the number of lives that have been saved by Dr. Semmelweis and his research, and the numbers of people who have been saved, it's immeasurable. I can't help but think about how many lives were lost because his research wasn't accepted any sooner. And it wasn't until he passed that research was accepted. And so I'm leaving you with that story to encourage you to continue to always keep your why top of mind, and leave you with the question to consider of what side of history will you be on. Thank you so much for having me, Rodney and Joe. And I'll also I'm going to share a link to an evaluation that consists of all of about 4 or 5 questions. But since we'll be doing this all month, we want to make sure that we're getting your feedback along the way and knowing what's most important to you about these sessions. Thanks again for your time. And without further ado, I'll turn the floor back over to you, Rodney.
Thank you, Rachel, for a wonderful event. Special thank you to our IHEN administrator, Corey Josie, who does a lot of the behind the scenes work that makes our organization run smoothly. Also, I want to say thank you to our IHEN Career Development Committee for putting in the work to make this program a success. And a special thank you to Joe Primavera. Thanks, Joe. I definitely appreciate all your work into this. Before I close out today's meeting, be sure to complete the evaluation that Rachel just put in the chat. Make sure you complete that. That definitely helps us out and helps us make our events better. Additionally, I want to share with you our upcoming events, which is being shared on your screen right now. And I know Rachel showed these. So while you're looking at that, I want to also take this time again to say thank you to our sponsors. A special thank you to our premier sponsor, Ice Miller, our platinum sponsor, Heapy, our gold sponsors, KSM, Cornerstone, Arc Design, and End of Care. I want to highlight too that we do have this, Rachel said it earlier in our program, but we do have the Ask the Executive Coach next week, March 15th at 4:30 p.m. She mentioned the April 12th event as well, how to advance when you have limited experience. And there's the third part right here. The third session is Talking Politics Online, recommended or forbidden. That will be on May 12th at 4:30 p.m. Here is some of the programs that we have coming up for the rest of the year. And it aligns very closely, Rachel, with the slide that you talked about that had some of the hot topics amongst healthcare CEOs. So Great Resignation, RN and clinical staff retention and turnover. That is coming up soon. We also have some programming in the works with regards to managing your clinical supply chain and precision medicine. We have our annual Indiana Innovation and High Performance Summit that HEPE puts on, and we part of that conference with HEPE, we tend to put on a Building the Hospital of Tomorrow program, as well as a Green Hospitals and Healthcare program. So looking forward to that. Programming or planning, I should say, is in the works for our annual awards program. So stay tuned for that. We also have an Understanding Implicit Bias program that we're working on, and Leading Information Safety, so cybersecurity. We have planning in the works for that. Also want to make sure that I say, as we are hopefully, fingers crossed, coming out of the pandemic, many of these programs will be in person, or hopefully that will be the case. So with that, thank you for your time. I know you guys can be anywhere in the world, but you decided to be here with us. And for that, I say thank you. You guys have a good rest of the day, a good rest of the week, and look forward to seeing you at many of these programs that we have coming forward in this year, and look forward to seeing many of you next week at the Q&A with Rachel. Thank you.